Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is what you need to know about joint arthritis. Arthritis is the #1 leading cause of disability in America, by far. There's over 50 million Americans affected. Arthritis is inflammation of one of your joints, with the main symptoms being either joint pain, stiffness, swelling, and typically it worsens with age. There are two main types: osteoarthritis, which is wear and tear arthritis, and then rheumatoid arthritis. The wear and tear is referred to as DJD, degenerative joint disease, and that's where you have cartilage that starts to break down. Rheumatoid arthritis is different. It's an autoimmune disease where your body actually targets the lining of its own joints, called the synovium, and then it leads to joint breakdown. Other types of arthritis are less common, such as psoriasis, which is psoriatic arthritis, lupus, and crystalline arthritis, which is often gout. In osteoarthritis, what you have is a ratio problem. We still make the same amount of cartilage as we always did, pretty much throughout life. But what happens is the ratio is off because you're losing more cartilage than you're making. Okay? So that's what happens. In rheumatoid arthritis, more women than men have rheumatoid arthritis. It's not hereditary. And what's happening is the immune system is actually making antibodies against your own tissues, predominantly the synovium of your joints, which is the lining of your joints, and it starts to break them down. Risk factors for arthritis: if you have a family history of osteoarthritis, it's more common. Increasing age, as you get older, it just becomes more common. Females are more common than males for rheumatoid arthritis. It's the exact opposite for gout, crystalline arthritis. Post-traumatic arthritis is a risk factor. If you have, a broken bone that goes into a joint, then a lot of times down the road you have more chances of having arthritis, such as in your knee if you have a sports injury or a car accident and you have a focal defect in your cartilage. That can cause arthritis. And then obesity, if you have more weight on your body, just more stress across your joints. The symptoms of arthritis are going to vary between individuals, and that's going to include pain, stiffness, swelling, and decreased range of motion. There are quite a few treatment options non-operatively for arthritis. The first and foremost is activity avoidance. If it hurts, don't do it, or alter it up. For instance, if you've been a runner for a long time and it causes pain in your knees from arthritis that's come on, switch over, cross-train with swimming or cycling. Instead of playing golf 5-6 days a week, cut it back to 3 to 4. Medications can be either over-the-counter, such as nonsurgical anti-inflammatories, Tylenol, topical pain medicines, or prescription, higher doses of nonsteroidal anti-inflammatories if you need short-term opiates for pain relief with exacerbations, and then prescription topical pain creams have a great track record for relieving pain. A brace can help a lot. Here you see an offloader brace for the knee. It can take pressure off of the arthritic area and switch it over to the non-arthritic and allow for pain relief. A cane can be a great, easy option for relieving a lot of pain and stress off of arthritic joints. Physical therapy and chiropractic. With physical therapy, you can strengthen up the muscles around the arthritic joint and take pressure off of it. Acupuncture, there's a lot of research behind acupuncture and arthritis, and then TENS units are an excellent option. Interventional treatments include such things as steroid injections, which have been around for decades as a gold standard. There was a theory a while back that steroids actually were deleterious to the cartilage in your joints. They showed that in small animals. When they got to larger animal studies, they didn't see that, and they've looked at some human studies, and they didn't see that either. So hyaluronic acid is another treatment. Hyaluronic acid is like the motor oil that's in your joints. They make it from rooster combs, and it's consistent products such as Synvisc or Hyalgan, and then it's injected sterilely into the knee or the hip or what have you. And it's been 65-75% effective for 6 to 12 months. It's been a very good treatment. Prolotherapy is an option. And then you get into regenerative medicine treatments such as PRP, platelet-rich plasma therapy, and stem cell injections. Small studies show that these have been excellent because these have the option to actually alter the course of the disease, not just provide pain relief as a band-aid like steroids. Radiofrequency ablation I put on here because it's been an excellent arthritis option for back or neck pain. It can provide up to 18 months of pain relief. The vast majority of patients are able to avoid surgery for arthritis or at least delay it. Joint replacements are not meant to last forever. It's a quality of life decision to have a joint replacement or a spinal fusion. Success rates with steroid injections or hyaluronic acid and regenerative medicine have been over 75%. Radiofrequency ablation for the spine has been over 80% effective. There was a study done last year on topical prescription creams, showed 83% effectiveness for pain conditions such as arthritis. Thankfully, arthritis never killed anybody. It's not a deadly disease. It's strictly quality of life that we're talking about. The top pain management clinics in Nevada are Nevada Pain. They offer comprehensive pain management at several metro pain locations, Summerlin, Henderson. Over 50 insurances are accepted. The number to call for treatment is 702-323-0553. And visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the network. Your pain stops here.